Very good afternoon, all of you. So these are the two important topics on supportive care, very hardly discussed, underestimated. We never discuss on the importance of doing physical exercise and its relationship with increasing survival in breast cancer. So this paper was published in JCO in November 2023. This is an international pooled analysis of leisure time physical activity, and that's a catch point that the patient has to do a physical activity during her leisure time, and premenopausal breast cancer in women from 19 cohorts. So as we know that there has been an association of doing physical activity and decreased breast cancer risk in postmenopausal breast cancer, but we didn't have any data as such in premenopausal women. So methods, basically it was an individual pooled self-reported leisure time physical activity data from 19 cohorts from countries in North America, Australia, comprising a large 5,47,000 women, multivariate Cox regression analysis to evaluate the hazard ratios, and 95% confidence intervals were taken. Hazard ratios for high level of activity, that was the 90th percentile, versus low level of activity were based on comparison of risk. And basically, how did they measure the physical activity? Leisure time physical activity were measured based on metabolic equivalents of task. So basically, a weekly questionnaire was collected from various sites, and that actually, so metabolic equivalent of task means the ratio between the energy cost versus the energy spent. So that was how it was taken. Of course, that's an abstract value. So basically, as we go to move towards the baseline characteristics, as we can see that the age at entry and BMI, they were equal between all the cohorts. But what is important is somehow where the women who had a family history of breast cancer, and also women who had smoked ever, they exercised the least. So least active leisure time quintile was there, and these were the baseline characteristics. So moving on, they had made a linear trend model that measured the hazard ratios with adjustment for the BMI. And as we can see, the hazard ratios for breast cancer in relation to leisure time physical activity, the first one is without adjustment for BMI, the second one is with adjustment. And as we can see that as the leisure time activity increases, we can see the inverse relationship between both of them. So moving on, the association of leisure time physical activity with breast cancer risk, and we can see that there was a graded decrease in breast cancer risk as the quintile of leisure time physical activity increases. So for further adjustment of BMI, we can see that the hazard ratios decrease to 0.91 in a graded fashion. So what was the relationship between leisure time physical activity and breast cancer subtypes? In an analysis was done for intrinsic subtypes. Within the non-luminal ones, the association markedly differ by HER2 status. For HER2 enriched breast cancer, higher versus lower activity was associated with a 43% reduction of HER2 enriched breast cancer risk reduction. So this was what I was saying, relationship between leisure time activity and breast cancer subtypes. There was some difference between luminal A and luminal B, but when we go to the non-luminal subtypes, the HER2 enriched, there was a 43% reduction risk. So when moving on to the next stratified analysis of breast cancer risk, somehow ladies who were underweight, BMI less than 18.5 with normal BMI, there was a strong association between with the breast cancer risk. And also white and Hispanic women, that also there was a strong inverse association. So moving on to the strengths of the study, this was a prospective study, large number of cases, 5,47,000 women. Methodologic differences and publication biases were also avoided. And but only thing is that substantial heterogeneity was there in distribution of leisure time between cohorts. There was a limited reporting of type, amount, frequency, and intensity of studies. So to discuss and conclude, inverse association was seen between physical activity and breast cancer risk in premenopausal women. A 10% risk reduction was seen after adjustment for BMI in premenopausal women. There was a stronger inverse association with HER2 enriched breast cancer, and physical activity somehow it leads to a reduction in the level of sex steroid hormones, estrogen, progesterone, the anti-inflammatory, and somehow was thought to postulate decreased breast cancer risk. Bharat sir, your comments on that?
I think so. Whatever we clinicians advocate to our patients and public as a whole for the prevention, one of the thing is physical fitness and exercise. So I think we'll have boost up with this very interesting data.
So probably we can include this in the clinics and serve weekly questionnaire to premenopausal young ladies who are under follow-up,
Yeah,
who are
definitely.
taking only hormonal maintenance.
Yeah, definitely. And
Can
you
we-
have also brought out the point of inflammation and physical activity, and certain our Indian diets have certain things for prevention of that inflammation. So we can have some research related data in our India.
It's not possible to understand the relationship with HER2/neu. What has physical activity got to do with HER2/neu?
There is no explanation for that association, but there's a sharp inverse association between HER2 enriched premenopausal breast cancer women and decrease in risk with increase in leisure time physical activity. There's no explanation actually for that subtype per se. Moving on to the next topic, also lesser discussed and mostly feared, is the use of vaginal estrogen therapy use and survival in females with breast cancer, published in JAMA. So the main concern is that we know that genitourinary syndrome of menopause can be treated with vaginal estrogen therapy, but then the safety and increase in breast cancer mortality is a concern. So the objective of this study was to determine if there is increased breast cancer specific mortality in females with estrogen creams. And as we know, there have been no randomized trials powered to investigate recurrence or mortality in this regard. So materials and methods: females aged 40 to 79 with newly diagnosed breast cancer from two large cohorts from Scotland and Wales were included. Population-based cohorts from Scotland 2010 to 2017 and Wales 2000 to 2016. Breast cancer specific mortality was taken until 2020, and data analysis was done between August 2022 and August 2023. So when we move to the baseline characters between the Scotland and Welsh population, we can see that the median age was actually 41 years. It was a long follow-up, around 5 to 8 years of follow-up. The baseline characteristics were very equally divided. And what is important is the cohorts actually comprised of a large around 50,000 females, 5795 breast cancer deaths, and with a adequate follow-up of 8 years in Wales cohort and 5 years in Scotland cohort, and 5% of females used vaginal estrogen therapy creams, and 1% actually received systemic hormone replacement therapy in the form of estradiol tablets. So basically, what's interesting is when we move towards the relationship with vaginal estrogen therapy with breast cancer diagnosis, and we can see that the women who used vaginal estrogen therapy, the p-value was not significant, and there was no increased breast cancer specific mortality. Even to women who had more than or equal to 5 vaginal estrogen therapy prescriptions from the oncologist, even those did not have increased breast cancer specific mortality. When we move to the sensitivity analysis between vaginal estrogen therapy and no HRT also, even when the analysis was restricted to ER positive breast cancer to women who used tamoxifen aromatase inhibitors, even those, as we can see, there was no increase in sensitivity or no increase to suggest that there might be an increase in breast cancer specific mortality. So to conclude, there was no evidence that vaginal estrogen therapy was associated with increased breast cancer mortality, and in the absence of trials of vaginal estrogen therapy in current times, these findings are very reassuring to patients using these therapy, and they are not associated with a markedly higher risk. Thank you.